And good afternoon. It is a Friday and it's time for our regular Lunch and Learn. And today is part 2 of Lyme disease. And we're going to be talking about the test that you can take. And then we're going to be talking about different treatments that are offered for Lyme. And so we want to look at that. This is part 2. I think there's going to be a part 3, depending on kind of how far we go today. All right. And so what we learned last week is that Lyme disease is a tick-borne illness. And it turns into a chronic disease, and it turns into actually multiple symptoms having to do with the autoimmune response in the body. And so there are 2 tests that you can take to determine if you have this disease. One is called the Western Blot test, and one is called the Elisa test, ELISA. So these look for specific antigens in the blood. But these 2 tests miss 60% of people that have Lyme disease. So in any other tick-borne illness as well. So that's kind of a crazy thing there. We don't really want that to happen. There is immunoglobulin testing as well that offers greater sensitivity and specificity than the standard 2-tiered testing method laid out by the CDC. These particular tests use recombinant proteins, and you might have heard that word because a lot of the shots that are on the market right now are recombinant DNA shots, and so we're looking at that. So it looks at different species of the Borrelia bacteria. So we're going to look at that, and this particular test is a little bit more effective. There's also the Cd57 test. And this particular test looks at your natural killer cells in the blood. Now, these particular natural killer cells will not diagnose Lyme disease, but it tells the physician if, in fact, the body is working and doing what it needs to do. So that's something that we need to kind of look at and see where we are. So, unfortunately, this particular disease is very, very resistant. The first line of defense that you're going to get from your doctor is antibiotics, and we certainly do want to use antibiotics where appropriate. But these antibiotics, what they will do is they will go after the bacteria will build up a resistance, and the bacteria will morph, and so the antibiotics will not work for a very long time. So the antibiotics are good in the acute stage, but they're not great in long term. So you want to know that, all right? So there's some other things that we can do as well as doing the antibiotics. Of course, you want to listen to your doctor. You want to do the antibiotics, but you also want to incorporate some other things into your system because it's really, really important. The disease is going to move from an acute phase into a chronic phase. And when that happens, your antibiotics are just not going to work any longer. So you need to kind of figure out what you want to do with that. So what you want to do is look at different strategies. One strategy that you can do is you can consume non-inflammatory foods. All right, so we have a list here at the clinic. If you just write into us, give us your email address, we'll send you this list of foods. Why do we want anti-inflammatory foods? Because every sickness, every disease is an inflammatory process. And so if you use your food properly, right, then you're able to combat some of the immune response. So we don't want to be able to do that. All right, so we're looking at that. So what are your inflammatory foods? They are sugars, refined carbohydrates, processed food. Okay, processed foods have a lot of heavy metals. They've got genetically modified organisms. They've got a lot of synthetic ingredients. So we don't want to have that if we're fighting a chronic disease. Okay, identifying and eliminating potential food sensitivities also take the burden off the immune system. And so that's what we need to do. Your most common sensitivities are gluten, which is a wheat product. So that's no pasta, no bread, no cereals. I know, don't hate me. I'm just saying, if you live in a different country other than the United States, your gluten is probably okay. Why is that? because here in the United States, the farmers will spray the crops with Roundup, and the Roundup will cause the grain to pop out, which is great because so the farmer's going to get more of a yield, but the grain is going to be contaminated. And so when we get that Roundup in the food, it goes in the gut, it kills off the mucous membrane in the gut, causes leaky gut symptoms, causes all kinds of problems with the gut. So we don't want to do that. When we get leaky gut, we get candida, we get food sensitivities, we get fungus. I mean, it's just not a good idea. We want to have the integrity of our gut where it needs to be. Okay, so that's really, really important. We also want to do fermenting foods like kefir. We want to do sauerkraut. We want to do all kinds of things like that. All right, so you want to make sure that you do that. We have a program here, a protocol here called Thrive in 63. We definitely want to incorporate something like that if you have an autoimmune disease, if you have Lyme disease. Why is that? Because the gut-brain connection is really, really important. If your gut is not right, if you've got leaky gut syndrome, if you've got pathogens in your gut, if you've got SIBO, if you've got H. pylori, all those kind of things, you're going to have gut-brain problems. You're going to have brain fog. You're not going to be able to remember anything. You're not going to be able to process your thoughts the way you want to. And so these are all the kind of things that we need to look at. And so we want to get you on a program for that. So there are a lot of different foods that you can eat to help with that. Fermented foods are the ones that we're recommending, but we also have protocols that will help you. It takes all the guesswork out, and it's really, really good for that, okay? We also want to support your immune system. How can we best do that? Vitamin D3, okay? Vitamin D is very, very important in immune conditions. Now, the doctors don't want to test for vitamin D. I do not know why that is. Doesn't make any sense to me because it's an easy test. It's like a $39 test. I don't know why they don't want to do it, but they don't think it's important. So when you go to have your annual blood work, please ask for your vitamin D test. Your vitamin D levels, all right, if they are optimum, you will have a strong foundation for fighting tick-borne diseases. So on your medical reference range, it's going to be anything above 30. On a holistic range, we want it to be anything above 60, okay, above 60. So that's a real big, I'm having all kinds of trouble with my technology today. My lights are going out. My broadcast seems to be going now. It's not scheduled to go till tomorrow, so you just bear with me. I'm having a little bit of technical challenges right here, okay? So there is an anti-inflammatory component to vitamin D, and so we want to make sure that your vitamin D levels are above 60 nanograms per deciliter, all right? Doctors tell me that if you are trying to keep your vitamin D levels up, you need at least 9,000 IUs every day in order to be stable. So if your vitamin D is very, very low, which most people's are, then you're going to need to do a little bit more than that. So you want to do it in a liquid form, not a capsule, not a tablet. It's not bioavailable that way. And you also want to make sure that you have vitamin K2 in that as well, okay? So here are some other anti-inflammatory herbs. Curcumin, resveratrol, omega-3 fatty acids support a optimal immune support, okay? And these will really help with your tick-borne pathogens. Now, I just want to say that curcumin, right, which is the ingredient in turmeric, is not bioavailable unless you have a little bit every day like they do, say, in India or countries where they have a lot of curry. So if you're getting a product from your health food store, you want to make sure that it is available. I know of two brands. One of them is Terry Naturally Europharma. Their curcumin is 9 times bioavailable than most of the things you're going to get at your big box store. Also, Physica Energetics, its curcumin is 20 times more bioavailable. So you do want to have that because that is something that is going to fight the inflammatory response, which is going to help you. All right, you also need antimicrobials. Now, what is an antimicrobial? Antimicrobial is a herb. It could be a homeopathic medicine. And what it does is it eats up the critters. Okay, so bacteria, virus, parasite, mold, fungus, all of those are critters. I know we don't like to think about having critters, but we do. There are all kinds of series on PBS. It's the Monsters Within, I think is the name of it. And it tells you all about the things that you are carrying around in your body. All of us have stealth viruses. All of us have bacteria. All of us have all the things that we don't want to have. And it is the immune system's job to keep those things suppressed, to kill them, to pass them out of the body. Okay. But if you've got a chronic inflammatory response, that's not going to happen. All right. So the antibiotics that normally are used to treat this disease are doxycycline and amoxicillin. Okay. Doxycycline. Sorry, I said that wrong. So these are two of the antibiotics that are normally used, but they're only effective in the very, very first stages. After that, you need to have some other antimicrobials. Now, your natural antimicrobials are a little bit different. Well, they're a lot different. One's natural, one's synthetic, okay? But what is best about the natural is the way it is designed. So your natural antimicrobials come from what? Plants. Plants grow in a natural setting. You don't have to plant them in a specific place, but wild, crafted, organic, medicinal herbs, they grow where God tells them to grow. They know just the design, creation design, the products, the plants know what we are fighting in the atmosphere. The plants know what the environment is throwing at us. So the plants are going to be very, very strategic in their properties, and the critters that we're trying to get have never seen these properties in exactly this way before. That's why a natural antibiotic, a natural antiviral is going to go a long way, because the critters haven't seen it before. It's not a standardized thing that they've seen. So we know, you know, that there's superbugs. You know that there are super infections, super fungal infections. Whenever a doctor tells you that you have a superbug, you have a super fungal infection, what he's saying is it has morphed into a situation where our synthetic drugs have no power over it. So we don't want to rely on that, because the super infections are antibiotic resistant. They are antifungal resistant. And so when you use healthy microbials, organic microbials, the bug has not ever seen this component before, and so it's going to be very, very effective. So each time a plant is grown, each crop that is grown is going to be slightly different because of the nutrients in the soil, what's in the air, what's going on in the atmosphere, and it's going to be the most potent thing that you can get. So this is really, really important. So you can get them over the counter, okay, but you're going to have to go to a really good health food store to get that. They target the harmful organisms where they spare the beneficial organisms. So when you take an antibiotic, not only does it get the bacteria that you're trying to get rid of, but it also kills all of your good gut bacteria, right? That's why we have to have good gut health to counteract your bad experience with the antibiotics. We want the antibiotics to kill the bad stuff. We don't want it to kill the good stuff. What we also do want, we want you to remember, if you're a woman, you've ever had a yeast infection, you've ever had an infection, you take antibiotics, what's going to happen? You're going to get a yeast infection almost 100% of the time. Well, the same thing with men too. They're not going to have the vaginal issue, but they're going to have the gut issue. So we need to make sure that that's resolved. With your natural antimicrobials, you don't have that issue. So that's a plus for the natural things, all right? And it helps your microbiome, okay? Antimicrobial herbs that have been shown to be beneficial for people with Lyme disease include Japanese knotweed, okay, quinine, cat's claw, sweet wormwood, Andiographis, Cryptolipsis, and astragalus, all right? Astragalus can also be used preventatively for those who live in a high-risk area or those who think that you might come in contact with a tick. So that's a good thing, okay? Also, oregano, cinnamon bark, and clove essential oils have been found to have anti-Borrelia properties. Now, I just want to tell you, you do not want to take your essential oils internally unless you are under the doctor's care who has an insurance policy that will protect you from the volatile effects of taking essential oils internally. Just going to throw that out there. That is the International Aromatherapy Guidelines. That's what we want to do. And so we want to make sure that you have those kind of things there. So do them in a diffuser. When you diffuse an essential oil, you get 100% of the properties of that oil. When you put it on your skin, you only get 25%. And when you take them internally, you run the risk of messing up your gut and having all kinds of different issues. So we don't recommend that at all unless you are under doctor supervision and they know how to treat you with essential oils and they have an insurance policy that will protect you and pay for your medical care if you take them internally and you happen to get a bad result. So we don't want that. Just going to tell you that. All right. You want to take specific binding agents in conjunction with herbs to help remove the pathogens and toxins from the body. So they're recommending here bentonite clay and different things, and I don't really necessarily agree with that. One of the things that we do with people when they come in, we make sure that they're moving their bowels 2 to 3 times a day before we ever start on any kind of detoxification program. Why is that? Because if you start doing a detoxification program or you're going after the critters, the bacteria, the fungus, the parasites, whatever it is, you go after that and their gut's not correct, they're not eliminating properly, all you're going to be doing is just rearranging the furniture on the Titanic, and we don't want to do that. So I'm not necessarily a fan of binding agents. I am a fan of psyllium. Psyllium acts like a sponge and it will absorb things in the gut and carry it on out of the body. So I am in favor of that, but I'm not in favor of bentonite clay, which a lot of people are. You may be a fan of that. I'm not, so we're just going to leave it at that. There are homeopathic remedies for Lyme disease, and we do have those here in the clinic, so we can help you with that. Other lifestyle changes that you can do besides your anti-inflammatory diet, you can exercise. Individuals with Lyme disease and tick-borne pathogens should exercise moderately, but be careful not to overexert yourself. All right, the physical activity is necessary to stimulate the muscles and nerves and mobilize your circulation, moves the lymph, but we don't want you to get overly tired so that you don't have the energy to heal. Okay, so you need to make sure that is happening. When the lymph flow is moving, it facilitates movement of the bacteria out of the tissues into the drainage pathways. What are your drainage pathways? Your bowel, your kidney, your bladder, your lungs, all right, and even sweat through the skin. So it's really, really important for that to happen. Quality sleep, okay? Quality sleep is foundational to a thriving immune system that's trying to overcome an illness. So you want to make sure that you're sleeping really, really well. Unfortunately, many struggling with Lyme and other tick-borne pathogens may have the organisms cross the blood-brain barrier and disrupt their sleep. So what is your blood-brain barrier? It is the membrane that covers your brain. You get blood that feeds your scalp, of course, but this membrane is supposed to keep everything out of the brain to protect your brain because that's mission control, right? Some things are able to cross the blood-brain barrier and implant themselves in the brain. There are herbs that will take care of that. There's homeopathy that will take care of that. So those are some things that we need to do. And so those are some things to look out for, okay? We want to make really, really sure. So if you're not sleeping, you might want to talk to your healthcare practitioner and find out what you can do to help with your blood-brain barrier and to clean up the brain, all right? They're asking you also to do breath work, calming essential oils and herbs, prayer and meditation, and avoiding the blue screens, your computer, your phone, all that kind of stuff for at least 2 hours before sleep. Stress destroys your immune system. So if you are in a family, in a workplace where there's the drama llama, all right, that's not going to be conducive to your health. So you need to make sure that you avoid all of that. You need to make sure that you are in a quiet and peaceful place. Now, there are adaptogenic herbs that will help with stress. There's also prayer, meditation, physical touch, all those kind of things. And all of these strategies will help you with Lyme disease. The final thing that you can do is to reduce your toxic load. What are the toxins? Heavy metals, plastics, formaldehydes, VOCs, BPAs, PFAS, all these words I cannot say, so that's why they have these anachronisms, okay? Herbicides and pesticides can all have a negative effect on your immune system. So you want to make sure that you get all of those moving out of your system. You want to have a professional to help you. Why is that? Because if you don't have a professional to help you, all you're going to be doing is translocating these pathogens, and you're not going to be doing yourself any good, okay? So when you're dealing with chronic Lyme disease, you want to make sure that you are eating well, you're sleeping well, you've got no stress or as little stress as you can manage, right? We live in a stressful time, but you can do things that are going to help mitigate that stress so that you are able to move forward toward health and away from chronic Lyme disease and the other co-infections that go with that. So this was supposed to air on Friday at noon. I see that it's airing now, so I don't know what to tell you, but have a great weekend, do some self-care, and I will see you next week. Take care.